Hi and welcome back to another video of Medic Notes. This video is on talar fracture. This picture shows the bones in the foot. The talus is the second largest tarsal bone and is also the second most common tarsal bone to fracture. For pathophysiology, most talar fractures occur through the talar neck, and, less commonly, through the body. Lateral process, or posterior process. The talus relies predominantly on extraosseous arterial supply, which is highly susceptible to interruption and fractures. Hence, the talus has a higher risk of avascular necrosis after fracture. Clinical features. Patients will present with a history of high-impact trauma, with immediate pain and swelling around the ankle. If the talus is dislocated, there will be a clear deformity. On examination, patients will be unable to dorsiflex or plantar flex their ankle. Also, check whether the injury is open or closed, and assess the distal neurovascular status. Investigations. Initial assessment of all suspected talar fractures requires plain film radiographs, both up and lateral views. Lateral films should ideally be taken in dorsiflexion and plantar flexion, to differentiate between type 1 and 2 injuries. For complex injuries, CT imaging may be required for further detailed assessment. This picture shows a CT scan, showing anterior talar fracture. Classification. Talar neck fractures can be classified by the Hawkins classification. Type 1 is undisplaced. Type 2 is subtalar dislocation. Type 3 is subtalar and tibiotalar dislocation. And Type 4, subtalar, tibiotalar and talonavicular dislocation. For management. For undisplaced fractures, conservative management. For displaced fractures, immediate reduction and subsequent surgical repair. Management of talar neck fractures is dependent on their Hawkins classification. Type 1 fractures can be treated conservatively in a plaster with non-weight-bearing crutches for approximately 3 months. Type 2 to 4 fractures should be attempted with closed reduction in emergency department. After reduction, place a cast, and repeat radiographs to ensure it remains in position. Definitive surgical fixation is required on the next available list. Complications. The main complication of talar fractures is avascular necrosis, occurring in 17% of cases following talar fractures. Other complications include osteoarthritis, which may occur secondary to avascular necroses. That's all for this video. Thank you.